What if I told you that a team of 75,000 healthcare workers banded together to forge history? Welcome to Hear the Web. I'm Tom.
And I'm Lily. Today we are diving into the story of over 75,000 union workers at healthcare provider Kaiser Permanente, whose decision to go on strike initiated the largest walkout by health workers in U.S. history.
This massive 3-day work stoppage involved everyone from nurses and pharmacists to lab technicians across 5 U.S. states and Washington, D.C. Any guesses how many patients could be impacted? A mind-boggling 13 million.
This action comes in the backdrop of stalled contract negotiations between the unions and Kaiser Permanente. Hospitals and emergency facilities, while remaining open, may feel the absence of such a significant section of their workforce.
It further complicates an already difficult situation. The previous labour agreement between the 8 unions part of the coalition and the company expired in September. At the heart of this drastic measure is the desire to pressure the company into addressing staffing shortages and wage issues that have been prevalent since the COVID-19 pandemic began.
And how has Kaiser Permanente responded? They've asserted that they have made substantial progress in discussions with the unions and remain committed to achieving a new agreement.
However, this strike isn't evenly spread out. The greatest disruption will occur in California, Oregon, Colorado, and Washington state. Hundreds of medical support staff here are ready to strike for 3 whole days. Non-essential services, including routine checkups or elective procedures, might be put on hold.
Meanwhile, in Virginia and Washington, D.C., around 400 pharmacists and optometrists plan on halting work for a day. Kaiser Permanente has somewhat prepared for this, though, expanding its network of pharmacies to ensure access to medicines.
Now, this isn't a story of desperate workers against a struggling company. Kaiser Permanente posted profits of about $3 billion in the first half of this year alone. It's only fair that contracts should be renegotiated considering the company's profits and the CEO's annual salary of $16M, not to mention the 49 executives earning over $1M.
This situation goes beyond numbers. Caroline Lucas, the executive director of the Coalition of Kaiser Permanente Unions, expressed how executives' inaction has led to treatment delays and preventable crises. Workers feel unheard and left with no choice but to take these drastic measures.
Michael Ramey, an ultrasound technician at a Kaiser Permanente facility in San Diego, agrees. He described his job as heartbreaking and stressful due to chronic staffing issues. Distressingly, he feels he can't provide the care patients deserve, which really captures the emotional toll this is taking on frontline workers.
It seems that strikes are in season. This Kaiser Permanente strike follows other notable strikes, like those of the United Auto Workers and the Screen Actors Guild American Federation of Television and Radio Artists.
There's definitely a trend. U.S. Bureau of Labor Statistics revealed that over 309,000 workers striking through August this year alone.
It's a reminder of the power of collective bargaining. In a world of increasing income inequality, worker strikes give the small guy a significant lever to pull in negotiations. Wouldn't you agree, Tom?
Definitely, Lily. To conclude, a strike by 75,000 American healthcare workers is unfolding, the largest in U.S. history. At stake are better wages, improved working conditions, and ultimately the quality of patient care. What comes of it remains to be seen, but it's clear it marks a significant part of labour history.
That wraps up today's episode of Hear the Web. Join us next time for more in-depth discussions on trending topics. Until then, I'm Lily.
And I'm Tom, bidding you a good day.